Yeah, my name's Dan Maclean. I'm a sports physical therapist. I've been a physical therapist for about 12 years now. Started Mac Performance Physical Therapy about a year and a half ago. Got my master's of physical therapy at Sacramento State. Before that, did a long-term internship at a facility called Athletes Performance, which is kind of where I gained all my knowledge and philosophy of treatment as a clinician. Performance-based physical therapy is kind of just that, right? We're looking to get people back to performance. I think a lot of the times physical therapy is meant to get people out of pain, which is step number one. But there's a lot of other steps in the rehab process that get people back to performing, whether that's wanting to go back to long-distance hiking, ultra-marathon running, sports such as soccer, football, basketball, court sports. That's more of the performance section, and there's a big difference between getting someone out of pain and getting them stronger, getting them faster, and making sure they're ready to perform at a higher level. As a physical therapist, one of the main things that we initially see and what people typically come to physical therapy for is because they're in pain, right? They're doing a certain activity level that's causing them pain. They can't perform at their prior level of function, and that's why they seek out help. So that's what we're here to do, is we're really here to help people get back to whatever goal that they have, right? In our treatment philosophy, there's pain, addressing range of motion, strength, and then ultimately function, right? So when people come in, a lot of the times they are in a lot of pain. And one of the biggest things that we have to do is alleviate that so that we can move on to that next step in the rehab process. Pain and inflammation is a big issue with not only restricting people from doing activities that they love to do, but also from muscles turning on from a physiological standpoint. So if there's pain and inflammation, there's a lot of inhibition to their muscles activating, which causes them to not be able to perform at a higher level. And so when we're talking about pain, there could be a lot of different reasons why a patient is experiencing pain. They could have a mechanical issue such as a tear in a tendon, a tear in a ligament, or something going on in a joint, which is causing a mechanical pain. There can be inflammation where there's swelling in the joint that causes pressure on the nerves that can cause pain that way. There can be a psychological, mental type of pain too, a fear almost of doing activity and the body remembering that there's pain with certain activities. So I think one of the big things that we can do when it is a mechanical pain or an inflammation pain is using cold therapy. And there's been a lot of debate over the last 10, 15 years on cold therapy, but I can tell you that one thing that the cold therapy does is it makes people feel better. And we're trying to get people out of pain, and when people are coming in because of pain, I think that's a big first step that we can take as clinicians and physical therapists. When we're talking about cold therapy, there's a lot of different options there too as well, right? You can have ice bags. You can have somebody get in a whirlpool, like an ice tub. There's different options for wraps and everything. We've found PowerPlay to be superior to a lot of other modalities for cold therapy for a couple reasons. One, I think it is pretty accessible. So the wraps that are able to go into someone's freezer, be taken out, utilized very quickly and comfortably. The accessibility of the PowerPlay wrap is very good compared to other modalities. The other thing that we found very beneficial with PowerPlay over other types of cold therapies is that it does have that compression component. And the compression component actually does help with that swelling part of pain. So when the compression is mixed with the ice, you get the pain modulation with the cold, the swelling modulation with the compression, pushing fluid out of the joint or area where they're having pain. And that combination has been very effective for our patients. A couple stories just to talk about. We've had one patient in particular that I can remember who more of a chronic knee issue, has had knee pain for several years and more degenerative in nature, leading to an upcoming total knee replacement. And this lady had a lot of issues sleeping. And sleep is huge for recovery. It's very important during the rehabilitation process. And she was unable to sleep. So she actually purchased a PowerPlay unit and was able to use that, and it really helped her sleep quality and allowed her to be more comfortable throughout the day as well. We've had several athletes use the PowerPlay wrap, not only in the clinic, but also after practices. And if they are remotely out at a field, they can use the PowerPlay with a bag that it comes with. And it's mobile, which is another reason why PowerPlay is a good option. As far as usage of cold and compression therapy, again, kind of like we discussed, pain is going to be an indicator that a cold therapy unit is going to be a useful tool for that patient or client. So anytime that someone is having pain, especially resting pain, kind of chronic pain, we typically have those people utilize cold therapy a little bit more frequently. So we tell those people somewhere around 3 to 4 times a day, 15 to 20 minutes usage at a time. And that can really help offset their pain that they feel all throughout the day. When people are getting out of pain and they're returning to function, and maybe as they are returning to sport, returning to the field, we're pushing that bar as far as how hard can we push somebody before they have an adverse reaction to the activities that they're doing. When we are pushing constantly and trying to get people better faster, there are times where a flare-up occurs, right? The knee gets a little sore, they get some stiffness in the knee. So with these people who it's more activity dependent and we're trying to return them to higher level activity, we typically tell those people cold and compression therapy is going to be beneficial whenever you feel like you've done a little bit too much. If your body is feeling a little stiff in your joint, or if you do have a little bit of post-activity soreness, that's another great time to use the cold compression therapy. And again, we just tell them about 15 to 20 minutes of usage, and a lot of the times that's enough to return their knee back to a resting state. When we're talking about inflammation, a little bit different than pain only, right? So typically when an injury occurs in any tissue in the body, there is an inflammatory response. So inflammation gets recruited to the area that's injured or damaged. And that's a natural part of the healing process. We need to have inflammation occur in order for healing to begin. So inflammation comes to an area. Typically that lasts between 7 to 10 days. After that, there's recruitment of scar tissue, which is needed for healing, right? And then you start to get out of the swelling phase and then move more into scar tissue formation, and healing can occur. The problem that we see in physical therapy is a lot of the times we're dealing with more chronic inflammation. So inflammation that has kind of stayed in the area for too long, or repetitive injury where swelling occurs a little bit more frequently in the joint or tissues that we're working with. So in situations like that, where there's more of a chronic type of inflammatory process, that's really where the compression therapy helps, right? And PowerPlay has the great unit that can do the intermittent compression, squeeze and relax several times through a cycle. And that compression has we've seen a lot of great effects in reducing inflammation, which can also reduce some of the pain that comes with a lot of inflammation in a joint or tissue. Inflammation will typically arise when people are in a static position for a certain period of time, and then they try to move out of that static position. So one of the big things that we ask people is, okay, how does it feel when you first get out of bed, right? Do you feel stiff? Do you feel a little bit more sore when you first get out of bed? And that's how we know people are either progressing or not progressing in that inflammatory phase. So anytime that someone is dealing with inflammation, we want to make sure those static postures and then going from a static posture to movement is improving. So we use those questions a lot to really see if there's any change, and also circumferential measurements of joints and tissues. Obviously, we compare that to the opposite limb, and as inflammation starts to decrease, then it starts to normalize compared to their opposite limb. Pretty similar to what we described with the cold therapy as well. Another thing that can help with inflammation, in addition to the compression that the PowerPlay offers, is getting into a better position where gravity can help assist the inflammation, right? So with the PowerPlay unit, it is important to have that compression, but also positioning your body in the most appropriate spot to where the inflammation can naturally flow down back towards your trunk. So for a knee or ankle, for example, lying on your back with your knee and ankle a little bit higher than your heart level will typically start to bring that inflammation back into your circulatory system. I think ideally, when we're talking about pain and inflammation, the cold portion of therapy helps with pain. The compression portion of therapy helps with inflammation. So when we're dealing with patients who are experiencing both, the PowerPlay is the perfect type of modality to help those people. So again, the cold is going to help decrease pain. The compression helps reduce the inflammation. And a lot of times the inflammation is also causing pain. So not only are you addressing the short-term pain that someone's experiencing with right now, but you're also addressing potentially like a longer-term pain that people are experiencing with inflammation, putting pressure on nerves and different structures around the joint. So the ability for PowerPlay to do both cold and compression at the same time is a huge benefit of using that device. We utilize PowerPlay to help out with a lot of different conditions that we see. People who are coming back from different surgeries, such as ACL surgeries or any type of reconstruction surgery in the knee. We also use it with people who are coming back from Achilles repairs, peroneal tendon repairs in the ankle. We've used PowerPlay a lot more recently on spine injuries and kind of chronic inflammation that we see in spine with arthritis or post-op conditions in the spine. We see a lot of shoulders as well, so slap tears, slap repairs, labrum repairs, rotator cuff repairs in the shoulder. It's part of our protocol at the end of each treatment session to finish with the PowerPlay unit in order to reduce any pain or inflammation that may be caused by some of the activities that they're doing. Yeah, and I think for people who are dealing with different conditions and specifically chronic conditions, right? So if you have a history of an injury, you've gone back to performing at a high level, but there's still some underlying swelling or stiffness that may occur in the joint. That's where the compression therapy can really be a benefit to those patients. Or people who are, people are staying active longer in life, right? So it's no longer just 40, 50-year-olds who are continuing to play recreational sports or aggressive hiking or running. People are staying very active into their 60s, 70s, and even 80s. We have pickleball is like a crazy sport right now, right? And there's people who are staying active later in life who are dealing with injuries that they may have had in their 20s and 30s. So for that subset of the population as well, the cold compression therapy of PowerPlay really helps those people as well. A lot of our patients will finish their treatment sessions with the PowerPlay device. So as they come in for their treatment session, we typically assess them, perform some type of treatment, whether that's manual therapy, stretching, exercises, functional movements, and then they finish with the PowerPlay device at the end. We do have a large group of patients who, after undergoing surgical intervention, whether it's in the shoulder or knee, who decide to purchase a PowerPlay unit and use it for home as well, which again, in the first several weeks after surgery, pain and inflammation are a huge problem. So we've seen people who utilize the device at home after surgery. They typically are a bit more comfortable. They typically can perform their exercises a bit more comfortably as well. And we hope that they're not having to use additional medication in order to supplement the different types of modalities that they're using. I think, when we're talking about cold and we're talking about compression, we're talking about pain and inflammation, so as long as an athlete, a client, a patient is not experiencing those symptoms, then that's where we say, hey, it looks like you've advanced into your rehab program to where you're not experiencing these symptoms anymore. At that point, there would be no added benefit to use the cold and compression therapy. When people are working out and you're getting just general muscle soreness as well, again, inflammation is a good thing a lot of the times when we're working out and tissues are healthy, right? So if you do have just general muscle soreness, it's not like you would want to ice it and compress it right away, because you get some of that micro inflammation around the muscles and the tendons, which is actually beneficial for increasing strength gains. As a muscle builds, it grows stronger. So we don't necessarily want to flush out all the inflammatory properties that occur with normal training right away. You want to give your body time to heal, get stronger, and recover. At some stages, it is beneficial to use compression therapy only versus using compression therapy with cold therapy. So if someone's experiencing, I would say, joint tightness and not necessarily pain, a lot of times that's micro-inflammation in the joint. So that's stiffness, or I'm just feeling a little bit slower today around your joints that you're working hard. There could be some micro-inflammation in there. So the compression could be beneficial at that point. But again, that's where you want to work with your skills coach or your strength and conditioning coach or your physical therapist and kind of decide if the program that you're using is appropriate to, meaning that you're not getting into a chronic overuse type of situation. There are a lot of different cold therapy options, right? You have general ice packs, you have gel packs, you have different wraps that can go in the freezer and you can just wrap it around your body. There's cold whirlpools, right? Or ice baths where you submerge your entire body or part of your body into a cold tub. I think, again, the benefit of the PowerPlay is that you're getting the cold therapy, you're getting the compression. It's very simple and easy for patients to use. It's very quick and accessible. You don't have to get wet, right? You don't have to continuously switch out gel packs. The gel packs that PowerPlay uses actually return to a frozen state pretty rapidly. So those are some of the benefits that we see with PowerPlay compared to other cold therapy units. It's been great speaking with everybody today. I would say, we talked all about a lot of different things. Whenever you're dealing with pain and inflammation, there's always a way to reduce that and feel better. So if you are experiencing some of those symptoms, contact your local healthcare provider, whether that's your doctor, chiropractor, physical therapist, whoever you trust in your circle. If you don't have a good resource, feel free to contact us at www.macperformancept.com. And we would love to help you out as well.